Hi everyone, Don Smith for R. Clark Media and TV 36, and today we are here to talk to you about physical therapy. And joining us today is Dr. Dave de la Fuente from Cornerstone Physical Therapy here in the township of Clark off of Brant Avenue. Dr. Dave, thanks for joining us.
Thank you for having me.
Dave, so many people have heard of physical therapy. Some may have already taken treatment of physical therapy. Let's start off with kind of a basic 101 of what exactly physical therapy is, or a lot of people call it PT. What can they expect? What takes place in the physical therapy office?
So physical therapy is used to promote and maintain health and wellness. We are the movement specialists. So sometimes when we have an ache or a pain, we have a hard time moving, whether it's we sprained our ankle or we twisted our knee, and now we can't function properly. So when a patient comes in, they get examined, and we can determine what the problem is. And with that, we can do modalities such as heat or ice or electric stimulation to help with swelling or pain. We can also, and then we customize an exercise program specifically for what your needs are or what your deficits are, in combination with manual therapy, our hands-on approach to help restore that movement or that function.
What are some of the things that people can expect when they come into a facility like yours? You said you get an evaluation by one of your therapists. I'm just going to throw a couple even smaller things. It doesn't hurt. I'm sure maybe it does. In my case, it was a little bit of that. Two, just from the facility itself, what kind of things do you have equipment-wise or exercises that the folks can go ahead and use?
So typically when a patient comes here, the first time they get an initial examination from one of our doctors of physical therapy. And we take a very thorough medical history. We find out what happened, how you injured yourself. And then we do all our different tests and measures to see what's moving properly, what's not moving properly, what's strong, what's weak, what's tight, etc. And then from there, we're able to develop a customized program for you between the hands-on manual therapy for my physical therapist, our exercise program, and even more importantly is the home exercise program that we give a patient so that they can continue on the days that they're not here. That compliance is what speeds up their process of recovery.
So your typical patient, how many days a week would things start out? Was it 5 days a week, 4 days a week, 3 days?
So typically we see patients 3 times a week initially, and as they're making progress, we cut them down to twice a week or maybe once a week as we're approaching their discharge. So we customize that based on what the patient's needs are. Now we have some patients that have a surgical procedure and they might need to come in 5 days a week initially. So again, it's all based on specific what the patient needs and what the patient's problems are at that point.
So for somebody, again, going back to just the basics, maybe someone who's not understanding physical therapy, how long would a typical session in your facility usually last?
Okay, so a typical session lasts about an hour, about 1 hour from when they come in to when they leave. Now the day of the initial evaluation, it's a little bit longer, there's a lot of paperwork that needs to be filled out. And again, our patients get to spend 1 hour one-on-one with our physical therapist during that evaluation. And that gives us the time to really figure out what's going on with the patient so that we can help them get to the road to recovery.
So now the average length of treatment would be how many weeks? Is it numbered in weeks? Is it months? Is it a year?
I mean, it depends on people's conditions. Sometimes it could be a couple weeks and sometimes it could be a couple months, depending on, there's all different factors. Sometimes it's how long have you had this problem for? We see a lot of people with chronic pain where they've had it for a long period of time and they've seen many other medical professionals, and then they find their way to us or to another physical therapist, and by then that problem becomes more of a chronic condition or something that's been around for a long time. In my experience, I find it takes longer just to get people better or feeling better when they've had the problem for a long time versus if the injury just occurred and then they come to us immediately. So to answer the question, it could be anywhere from a couple weeks to possibly a couple months.
Dave, I know you offer a really great service and you've been doing this for some time, but now with the pandemic over the last 18 to 24 months is home care. Can you kind of explain to our friends about the home care services that you offer?
So from my experience, I keep things very simple. I'm looking to give a patient a couple exercises so they can go home with some tools that are going to help them make them feel better. So my school of thought is I only do 3 to 4 exercises, things they typically can do in bed. And the reason I do the bed, I feel it's very, very difficult to get off the floor. Maybe some people don't think that way, but
I agree with you on that.
So some people feel like the floor is a firmer surface, it's a better choice. I just feel if I'm doing all these great things to make myself feel better, why do I want to strain and get off the floor? So I'm fine with patients doing the exercises in their bed. It might be just a couple of different movement patterns. It might be a couple gentle stretches, and it's something that will educate them and make sure they can demonstrate safely before they go home.
So the injuries or problematic areas that you see, I'm just going to just throw it out there. Would you say that maybe number one potentially is the back?
Yes. Backs and necks are the most common. And I'll be honest with you, since the pandemic and COVID and people sitting at home on their computers a lot of neck, shoulder pain, headaches, very, very common because we're sitting on computers all day, sitting on laptops. You know, a lot of people are trying to set up their own home office the best they can, but there's really a whole ergonomic assessment that needs to be done to make sure things are at the proper height, they can maintain good posture and things like that. So those are all real common things. So, and a lot of people, it's interesting, you know, I get to talk to a lot of people, and a lot of people are working a lot harder at home than they probably were in their office. You know, they're sitting on their computer all day, they're on their tablets, they're on their smartphones, you know, and as you know, we all sit prim and proper, but after a couple minutes, we all kind of slouch and our heads are forward. Puts a lot of stress on your neck, you know, and your shoulders. So neck, spine, very, very common, the majority of what you see. You know, obviously shoulder problems, depending on what you're doing. If you're lifting and overhead, a lot of overhead, your overhead athletes throwing, very common.
And especially that neck area, and like you said, keeping that good posture, you know, like you said, after 10 minutes, you're kind of like this.
So, I mean, a good rule of thumb, you know, and I always tell people, you should try to get up at least once an hour. If not, maybe even once every 30 minutes. Just get up. It doesn't matter if you just do one lap around your living room and then go back and sit down. Just to change positions, because again, it's real easy to do that. The other thing that's real important too is, like you mentioned with your eyesight, you should be bringing the monitor to you, not you going to the monitor. And that's what happens. We're here and our eyes start getting tired or dry, then we start migrating forward. You really should be bringing it towards you. And the other real important thing we're talking about a computer monitor, because we're all on computers today, is when we're looking at a computer monitor, we should be looking at the top third of our monitor with our head level. So a lot of your monitors today can slide up and down, or you can stick books and phone books underneath them, whatever it is. But with your head straight, you should be looking at the top third of that monitor. That's a very important thing because, again, so that we're not doing this or we're not doing this for an extended period of time.
So with the home office, should you alternate between sitting and standing? You know, maybe do 30 on sitting, 30 off standing up, and vice versa. If there's a way you can, you know, do a standing type desk or office. You
know, it's interesting. So that became a very, very popular thing since the pandemic. Are these standing desks? They can vary in price, obviously, but I think it's because people know there's a problem. Sitting causes poor sitting posture, I should say, causes a lot of back issues, a lot of spine issues. So I don't think there's necessarily a number or a recipe to say yes, you should stand and sit for 30 minutes each. I think just alternating positions is a great idea. For me, I'm a stander. I stand all day. I don't enjoy sitting too much. I actually stand when I'm doing my documentation. I stand on a tall counter over there. I just like to stand. Now, once in a while, do I want to sit when my feet hurt? Absolutely, I do. But the majority of my time is standing and walking around because that's what my body likes. Now, everybody, again, is a little bit different. But again, I think those standing desks are a great option for people. And I also think a great office chair is a great thing for people with adequate support. You know, where you need support and where I need support are just different. Our bodies are just different. But I think a good lumbar support, whether it's an external device or something that's built into the chair that fits you right, is real, real important because that's going to prevent the whole slouching. And you want to, once you slouch, your head goes forward, your shoulders get round. You maintain good posture in your low back, your head and shoulders will automatically stay back. And that's a real important thing.
Great. Dave De La Fuente from Cornerstone Physical Therapy here on Brand Avenue in Clark. Thanks for joining us.
Thank you very much. I really appreciate it.